So what I want to talk about today is not surprising, health data, the Health Data Consortium, and what I call patience and impatience. But I thought, this has been such an inspiring conference, and you've covered so much ground here that I wanted to kind of go a little bit further up than just open health data to kind of talk about the power of health data, I think, is a transformative force in general, and how the Health Data Consortium is working to really think bring to life some of the real potential of data to have a fundamental and transformative impact on our system. So we're going to talk about open health data, but we're going to talk about other areas of data as well and how we sort of bring that all together. But open data is the tip of the spear. And so as part of a larger movement, it is incredibly important sometimes to break that ground, to really understand where the most important and valuable areas of data are. But we can go much further than that, which is part of what we'll explore here today. Also, I remember when I first spoke with Daniel, and one of the reasons that we hit it off so well at first is we started having this conversation where we were finishing each other's sentences around health and human services data and looking at that much more broadly. And so that's something as well that I've sort of taken with me now around the country as well. But it all does start with open data. So we'll get to that. Let me sort of contextualize data very broadly. Data's everywhere. So if you take that deep breath, that ozone smell is data permeating everything we're doing. And it's accumulating at a faster rate than I think anybody would have imagined a few years ago. In fact, you've probably heard some of the great statistics that we've accumulated more data in the last 2 years than in all of prior human existence. I was recently sort of lucky to tour the supercomputer labs at Oak Ridge National Laboratories. I actually got to see what a exabyte looks like. An exabyte looks like about the size of this room. But they're staggering amounts of data, and we're getting those data from all kinds of different sources today. So with all of that data, you'd think we should be able to find new insights, translate that into new policies, new things we can do, and that's exactly the point. That data is everywhere, but we need to put it to work. And so how do you put it to work? First is you need to understand data for what it is. The value of the data is not the exabyte of data. The value of the data is that if you think about it as the encoded history of everything that we know, then it should be the single most important factor in informing what we do next, in changing policies, in creating better interventions, in essentially shaping the future and every aspect of that future based upon all of that information. That's the Holy Grail. So we want to put the data to work to do just that. And because the data has this incredible value, but we haven't had access to it in myriad ways in the past few decades, now that we do, we should be putting that data to work in every aspect of health, human services, government, and even more broadly. So that promise of the data is unbelievably powerful. And in the arena of data, health data might just be the most powerful of them all. If you think about the amount of data thrown off by a $3 trillion economy, the health care system, and what it would mean to that system, whether it's better care, better affordability, better allocation of resources, it is unbelievably intriguing. And the amount of that health data is also growing exponentially. So how do we put that to work? Well, one way to sort of really get a visual image of the power of that data is to start to think about the kinds of things specifically you could do with it. And what I'll do here is I'll talk about that, but I'm going to talk about it in terms of the kinds of things we could do. Right? What if we could answer questions like what environmental and social factors don't we know about that correlate to better outcomes? Or what children really are at risk? What if we could integrate better data and information into all kinds of areas in health plus human services? Better decisions at the point of care, better patient monitoring, better predictive models that let us understand where interventions will be needed way ahead of time so that we can put those together in the most powerful ways. Integrating all the data that we have and information around a patient or a child or someone in the system so that we can really deliver the best possible services exactly when they're needed. And what if you had all of this information? Where are the most vulnerable populations, and where must we focus our resources? What if we really did understand better than we do today where the health disparities are by county, by state, by system? What if we really did understand that certain kinds of medical procedures just aren't up to snuff in this area of the country, and they can learn a lot from this area of the country? Incredibly powerful, that information. What about doctors and hospitals and who's best suited for a particular treatment? And isn't that really valuable data that every patient should have? And what treatment options are broadly available? What will they cost? What are the pros and cons? Really sort of enabling everyone in the system, starting with every human being, 300 million people in our system, with the information that they need. So these are all really, really powerful. If we had this information and it actually pervades the system, then we can do some incredibly powerful things. But it is a complex system, right, isn't it? So we took a look at, this is what I call the Honeycomb Chart, and this is just sort of scratching the surface of where all the stakeholders in the system are. So, it's not just state government and counties and municipalities. It's insurance companies, it's large employers, right? It's research institutions, it's pharmaceutical companies. So the reality is we've got a very complex system. We have enormous potential that can be derived from the data, but we have to take a very holistic view as well. And so it's incredibly important that we sort of contextualize all of that. The open health data programs, like what you are, I think in such an inspiring way here, pushing forward in California, that is that tip of the spear, but it's a pretty big spear as well. We've got a lot of work to do to really bring this stuff to life for all 300 million people in this country. But make no mistake, the benefits will be substantial. I've talked in qualitative terms, and as you've also heard probably numerous times already, various organizations have tried to actually dimensionalize the economic benefit as well. And of course, McKinsey's estimated that $300 to $450 billion in cost savings are possible. I don't think you take that money out of the system, by the way. I think you plow it right back into the system. But the point is we can really deal with triple aim level benefits system-wide by putting that health data to work. It's absolutely vital. So, I think Brian alluded to this a little bit yesterday. It is incredibly important if you're going to try to drive some kind of system-wide change at this level that you have a forcing function. An awful lot of my early years in business was in management consulting, and I got to spend a lot of that time helping different industries and businesses through this very painful process of what is the internet going to do to me. And it was pretty interesting working with boards and others that were pretty darn convinced that the internet was going to fundamentally change their business, and of course it did. But when you look across those kinds of changes, there are industries that change, and there are industries that don't. And the industries that don't change typically don't have a real forcing function. You need something that fundamentally pushes a system to behave very differently. Some call that sort of this notion of a crisis is a terrible thing to waste. Well, I'm going to say that the Affordable Care Act, healthcare reform, these new risk-sharing models and reimbursement mechanisms, and sort of the emergence of really evidence-based approaches to care are fundamentally changing the system, and we can't go back. That's a good thing. It means that we can actually drive some of the change that we need to, but again, it will all be data-intensive and data-rich. So let me introduce you to the Health Data Consortium. We're a public-private partnership. We're a 501c3. We're based in Washington, D.C. We're an advocacy and membership organization, but I'm going to use the word membership there very broadly. Fact of the matter is we represent 300 million people. So from our point of view, we have a goal in life, and that's to put this health data to work in all of its forms, because every one of us have children, every one of us have family. That's what we need to do. So it's a membership organization with a really, really big M, if you will. Our membership is, I think, pretty impressive. It runs from groups like the Health and Human Services, the U.S. Department of Health and Human Services, to the California Healthcare Foundation, to the Robert Wood Johnson Foundation, to, General Electric, to Merck and others. And these are all organizations that, quite frankly, are behind the cause. They know what we need to do. They don't necessarily know how we need to do it. And they see the value of a public-private partnership in the middle to represent the whole system as a very powerful way to catalyze that energy and drive the constructive outcomes that we're all looking for. So what do we care about? We care about transforming the U.S. healthcare system through health data. We think it's vital to liberate health data in all of its forms. We're establishing the ecosystems, promoting health data use, and hastening the movement in every way practical at the national level. And quite frankly, we see this as an exercise in opportunity cost. Here's what I mean by that. From my point of view, every time a procedure is improperly prescribed, or every time a drug interaction that could have been prevented isn't found, or every time we do have a child where an intervention earlier on could have made a big difference and it's not, the opportunity cost of that was suffering, right? Our real opportunity here is to do this and do it with haste and do it as quickly as we can, measured in years, not decades, because if we do that, we can have that, not only that fundamental impact on the system, but we can save lives and improve the human condition. Here's an example of some of our members and partners. I'd also like to point out that a number are represented here in the room, including ESRI, HHS, and the California Healthcare Foundation. So you've heard a fair amount about the Health Datapalooza. I'd like to just point out that the Health Datapalooza this year is June 1st through 3rd in Washington, D.C. The 2nd and 3rd are the main days of the conference. But it's interesting. So the Health Datapalooza, by way of a little bit of history, came out of the Health and Human Services Health Data Initiative, as you all heard yesterday. But we never talked about where it actually went. Where it went is the Health Data Consortium is now the official convener of the Health Datapalooza. So last year was the first year that we sort of owned and operated the event, and it was an absolutely riveting experience. I would encourage all of you in the room that are really as deeply passionate about these things as we are to attend. I call it sort of the TED and Davos and South by Southwest of health data all rolled into one. You know, this is that opportunity to sort of really meet policymakers in the hallway, have lunch with venture capitalists, meet data scientists for a drink after the session's over, and then sort of, you know, walk down the hallway and then find an incredibly inspiring and informative session on exactly the kind of thing that you care about. So I'd really encourage you to sort of get involved in that. Now, let me talk a little bit more about specifically what the Health Data Consortium is focused on. Our focus is in 3 areas, and this is where some of that additional context I think will come in handy. So we're focused on open health data, the very thing we're talking about here at this conference, and that is advocating for the release of health data from government sources, be them federal, state, local. There's an enormous amount of value pent up and locked up in these organizations. And if we can pull that out, we can do tremendous good across the system. But also system-wide sharing, right? Enabling and promoting data sharing across the system. So whether it's insurance companies or pharmaceutical companies or research organizations or community foundations, how do we get the data flowing amongst all the participants in the system? Again, open health data is the tip of the spear, but we've got a very broad set of stakeholders as well that need to participate. And then finally, what we call human-centered information. And that is, this all needs to ultimately impact the human condition in this country. So we get the data dislodged, we share the data between all the parties, but we need to have it actually improve life for everybody in this country. And so how do we do that? So our focus is that, get the data, use the data, and then put the data to work to improve the lives of patients. So let's talk about what we're doing right now in the open health data realm specifically. So particularly in 2014, we're focused in 2 areas. We're advocating for the release of all de-identified data across the system. And what we have found is that it is, this is not as hard to sell as it might sound. It's just hard for organizations to change and adapt. It's coming. It's coming across the country. What you're doing here in California is an absolutely inspiring example of that. It's coming. You can feel it. You can feel it with the energy in the room. But the examples, sharing the best practices, essentially ensuring that all of the states and the communities can learn from each other, create a community of practitioners around this that ultimately will ensure that this is across the entire governmental realm. But also to promote the operational readiness of the data. So just putting the data out there is actually the start. But if we're now going to have applications and hospital systems and participants across the system depending on that data, then what we're going to find is that data needs to be operationally ready. It needs to be high quality. It needs to be maintained. It needs to be described, right, so that it can actually be used in all the right settings. And for a lot of organizations, that's probably going to be the second or third step, quite honestly, but it needs to be done. If we're going to put the data to work, not only do you need to show your data, but we need to make sure that that data is ready, able, and appropriate for use in the real world over time. And of course, we also play this role of driving the movement, right? A lot of what is going to push this along in the government realm is every one of us getting excited about the possibility and communicating to lawmakers and policymakers and agency heads. So, I kind of hesitated to use them, but I couldn't sort of help myself with the whole Braveheart thing. Freedom, free the data, or Mr. Gorbachev, tear down this wall. But the point is, we're also sort of leading that national movement to really create this energy and translate that into change and adoption across the governmental system. System-wide sharing, that was the second thing on the list that I just talked about. Enabling and promoting data sharing across the whole health system. This is really a complex area, right? So how do you get data shared between different parties? They're concerned about HIPAA. Sometimes they stand behind HIPAA as the excuse for not sharing data. If you're in an industry where you spend a tremendous amount of money on research, that's intellectual property. You've paid the bill already for that. So how do you find ways to share data that doesn't compromise your ability to get returns on your investments in research? And so there's a lot of complexity to this, but I'm pretty darn convinced we can find ways to bridge that gap. And you see some very promising activities recently, for example, where a number of pharmaceutical companies have announced cooperative agreements to make clinical trial data available for patients. Bravo. Those are exactly the kinds of things that give us the bravery and the confidence to do more and more. And by the way, I'm also convinced that if you put a lot of money into R&D, you do have a right to sort of see some of those returns come back. But it's probably a middle ground between the way the systems operate today and here, and an awful lot of that data can be shared for the public good. So we're very excited about that. One other point I'll make is this is going to take the public and the private sector using data much more effectively. If we can do that, then you have this sort of transformative impact on the system at that level. But sort of bridging that gap between the public and the private sector is incredibly important here. And so that's one of the unique roles that the Health Data Consortium plays. Some of the things that we're doing here, I'd like to highlight just to kind of give you an idea of where the rubber meets the road. The first one here I'm happy to talk about because of the development of it was actually funded by the California Healthcare Foundation right here. And this is what we call the Health Data AllStars. It's hosted on the Health Data Consortium website, but it's 50 top data sources from around the country that you may or may not have heard of. I am just thrilled when somebody calls me up and says, we had no idea that there were data sets in Vermont that talked about X, Y, and Z. Thank you for helping us get there. Sometimes we don't even know what data is out there, and just connecting the data consumers and the data producers is incredibly interesting. And so we see this as sort of a complement, if you will, to healthdata.gov because we're focusing a lot on the private sets, things that wouldn't necessarily be on healthdata.gov, but I think between the two of them, it's very, very valuable. And the next phase of this is essentially in planning. We also have been working on something we call the Health Data Bill of Rights, right? And so what does it mean in this new world? I mean, what is the obligation of a for-profit and a nonprofit and a foundation and a person? It's really interesting to me. If you ask people how important their health data privacy is to them, you know what percentage say it's important to them? 100%. If you ask them, would you share your data for research purposes, as long as you knew how it was going to be used? 87% say yes. So we already know that we've sort of not taken full advantage of the patient's role. Well, there's also the role of every other stakeholder in the system to really do some things dramatically different. So the Health Data Bill of Rights is a work in process, but something that helps contextualize all of that. The Open Health Data Scorecard is something very interesting. We're building we're just now finishing the feasibility study for this, and we hope to move to the next piece of this. But what does it mean to actually sort of understand where the laggards and the leaders are in the space, whether it's for-profit health companies or startup M-health companies or states for that matter. And so could we create scorecards which help us understand where those are? But more importantly than the scores, if the leaders are doing three things consistently, doesn't that help the laggards know what to do next? Isn't that best practice of sharing at its best? So we're looking at those kinds of programs. And the third piece of this that I talked about, human-centered information, it's really about putting that patient in the middle. And so elevating the role of every one of us in the system, ensuring that the dividends from the data really make its way to the patient. And there's some very important pieces of that we're taking on early on here. And two of them that I'd like to point out is sort of rethinking the role of the patient as part of a broader architecture of information. Why can't you take your data from your Fitbit in your pocket and seed that data systematically to your doctor who's trying to help you with, you're pre-diabetic. And that's an important aspect of your treatment regime. Has anybody actually tried that? It's hard, right? You can't do most of that stuff. For that matter, your doctor actually most of the time doesn't even want to see the data because the last thing he needs is one more set of data as inputs, and in this case, it might not even be from a trusted source. So how do we sort of rethink the role of the patient to put the patient truly in the middle of all of this, where they can seed their data, control their data? For God's sake, actually see their health data record. Blue Button Plus has done a tremendous job of increasing this, but I don't know how much of it has yet impacted every single person in this room. Have you all seen Mint.com as an example? Do you know what I'm talking about? Right? Wouldn't it be nice to have a Mint.com of health data where you're just really at the middle of that, you can control it and see it? So this sort of rethinking of the patient in the middle. And one other thing that I'll add on the list down here, which really permeates all of these, is how do you know that that patient over there is that patient over there? We constantly see problems where data's released or shared, and it turns out we didn't really know that Dwayne Spradlin was that Dwayne Spradlin. And you see it whether you go to a hospital and they can't get the other half of your health records from when you lived in Illinois, or we see it when you're actually trying to figure out some way to get the data from your Fitbit or anything else sort of correlated with you, and you can't do it. So all kinds of techniques are used to sort of match patients, but the reality is none of them are terribly good today. So we need to find better ways of sort of linking data. Why? Because the more we can link data, the more appropriate, accurate, and holistic the benefits of this will be for each and every patient. So we've got a lot on our plate. Through all of this, of course, it's critically important that privacy issues sort of permeate everything that we do. So that's top of mind for us as well. So between these three things, it really is about getting the data, using the data, improving health, right? And so I wanted to provide that context at the national level to say, you're at the tip of the spear, but you're not done by just putting the data sets out. We have an awful lot to do, whether you're sitting in an agency chair or a developer's chair or a journalist chair. We've got this whole agenda that needs to be rolled out and progressed over the coming years. I also wanted to say I think change is really good, right? I'm a tech guy. I'm not, I'm only partly a healthcare guy. I'm a tech guy. And so, I live off change. I mean, that for me that's what you get up in the morning for. So I love this stuff, but I realize not everybody does. I want to tell you, I think everybody in this room should embrace change. It's exciting. You see things like this every single day, right? Where, 3D printing, only now we can print tissue that could be used for, organ transplants. You see social networking, and now you see opportunities to use some of those social connections to better understand when we might have a child at risk, because some of the signals are there. How often are we hearing now, we could have maybe known that if we looked more closely or more systematically. So the use of technology to fundamentally improve all of this, I think, is unbelievable. And it's not stopping, right? I mean, we're connected and mobile, and we're working on applications right now that use, that can use phones to get medical information to, people in rural areas, that can get services information to them exactly when they need them, right? There are now more phones than people. The point's not the phone. The point is we've got ways, we're connected peoples now, and we can put all of this to use, which is really, really exciting. And sensors are everywhere. You know what sensors are to me? It's another source of data, and I love data, right? So whether it's cameras or, accelerometers or anything else, I mark my words, in the next 2 or 3 years, the first phone's going to come out with an easy attachment that lets every single person check air quality locally. It's coming, right? That kind of thing changes everything, and we should be embracing that. It's exciting, but it's all data-driven. This is all data, and we want to put the data to work. And we're already seeing some of that today. So you heard about ITriage yesterday, right? Getting people the information they need when they're ill, or maybe not yet ill, but getting it when they need, and then where they can go to actually get services. I saw an inspiring video of somebody who credits ITriage with saving his life. He said, if I hadn't had it on my phone when I had those symptoms, I would not have survived 24 hours. This all by the way, most of the data that drove ITriage was publicly released government data, right? It was now in a form factor that person could use. That's exciting, right? But this change is everywhere, and just to kind of give you a couple more tidbits, have you heard of a company called Proteus? Hey, what do you think about pills that can actually wire, that they're in your body, you've taken it, and by the way, here's some local sensor tests just in case you need them, but the pills are smart pills, right? We're seeing this. Imagine what you could do with all kinds of different sensors. 23andMe. Now, I will be honest, loving data, I'm not so happy with the FDA's recent rulings on 23andMe, but I understand them. But 23andMe is another incredibly valuable example. Now we've sort of consumerized things all the way down to genetic testing. Incredibly valuable. I just really put this up here to say one other thing, which is when I showed this to my kids, the only thing they really cared about is apparently I'm 3.1% Neanderthal. I pointed out elevated risks of X, Y, and Z, and that didn't register with them. This did. So look, we're at an exciting time. There is a broad agenda here that goes well beyond open health data, but we've got to get the open health data right, and that's why the Health Data Consortium is here to support you in all of these efforts. Consider us your partner in all of these things. And embrace the change. It's an exciting time. One of my favorite Kurt Vonnegut quotes is right here. I want to stand as close to the edge as I can without going over, because on the edge you see all the kinds of things you can't see from the center, right? You want to be out there. We're doing some things nobody else has done here before. This is exciting. Embrace being out there on the edge, and let's make this stuff all count, because I think we can improve health and health care and human services for everyone. And then I just want sort of one more point I wanted to make. I call it patience and impatience. And so I don't know if you can tell, but I'm actually pretty passionate about this stuff, right? I care about this stuff. But I want to say it comes from a very, very constructive place. But there's also a piece of me which believes we can't not do this for all kinds of really, really important reasons. And so let me ask you, how many of you have ever been a patient? How many of you have ever been a human being? Good, that's most of you. Look, here's what I mean by patience and impatience. We have to be a little bit impatient too. So take off your agency hat, take off your journalist hat, just be a human being here for a moment, living in this system, knowing that we've got these data assets now and an increasingly accelerated rates coming online. We can do so much with this to improve it, and we've only scratched the surface, right? And so the way I think about that is impatience. So a child falling through the cracks in our system, I'm sorry. If we can prevent it with the data, and we're not doing everything we can do, and data and information are probably our most powerful asset, then that's not okay. An adverse drug reaction, as I mentioned earlier, I mean, the number of these that are absolutely preventable, if not in the doctor's office, at the point of sale, is unbelievable. It's not okay that we don't catch every single one of those today. And of course, the costs in the system and the human toll are incredible, right? Not knowing who's the best doctor. I just heard a harrowing story about, certain parts of the, bone marrow transplant registries and qualitative data is available all over the country. Very few states actually allow patients any access to that information. And there's a huge disparity between outcomes in certain parts of the country versus others. How would you feel if a family member, right, got a bone marrow transplant and you found out later, everybody knew that was the worst place possible to go, but you weren't allowed to have that information? It's not okay. It is not okay. So I'm asking you to also be impatient. So this is not a policy plea on my part. This is not anything other than saying, as human beings, as somebody with 3 children in this system, right, take advantage of the opportunity to have your voice heard. Let's get the data out there, let's get it used, and let's improve every aspect of this system, because isn't that what we're really doing this for? So with that, I hope it was helpful, and again, consider Health Data Consortium your partner in everything you're doing. It's incredible what you're doing. Thank you. I probably used my time. Do we have any time for questions? Okay, any questions? Yes.
I was very excited to hear what you had to say. I just want to offer one small caution. There's something called computational complexity, which is part of.
It's hard to hear. Sorry.
So yeah, computational complexity, which I think figures in here, and I think in an important way. A lot of the questions you're asking are not simple. Linking all the data together, and for example, I know a lot of physicians that work in public health hospitals. Public hospitals, they get cases that are much more serious than other physicians in the suburbs. Their outcomes are worse, but actually they're better doctors. Mm-hmm. There's a lot of issues about, I think we need to start thinking about strategies in terms of how do we actually make this data usable, because there's so much available, there's so much you can pull off the service, but not all of the stuff we can pull together right now and report necessarily makes sense. And I just want to be somewhat cautious. I think there's a big role here for the actual scientific component. It's not the same as just doing queries anymore. We've really got to think through strategically, how do we improve, how do we actually use this data in a way that's going to be meaningful in the long run. And that's not to try to stop what's going on, which I think is fantastic, but I think there's this component here that I think is now got to be taken much more seriously, to pull more of the academics in and get some strategic views of how do we really drill into this data, especially around healthcare. Because if we don't do a good job, you know, people will recognize that and they'll be saying all this open data and all this other stuff hasn't really yielded the results we wanted. So it's just a caution. But I mean, I'm very enthusiastic about what you've done, and I appreciate your call very much.
Well, you know, your comment's right on. So, by the way, you've just taken me back to my class in computational complexity. You know, I think that what we should be encouraged by is so, at the end of the day, this is not about the technology. These are all social constructs. So we've created this, which means we can change them. And I think largely we have, I'm going to use the word consumer here, meaning 300 million people. Consumers have turned out to be smarter than we ever gave them credit for. These systems can adapt in very positive and constructive ways. We've seen it in other industries. We need to be responsible here. These are health matters. So we need to be responsible. I agree. I also know, though, that we put enough energy behind it, we can solve those problems. And I think part of what's exciting about the energy here is there's a can-do. There's a can-do energy here. And I think with that and the right people at the table solving those, I think we can do darn near anything. I don't mean to sound like the eternal optimist, but I'm pretty optimistic about this. But your comments are fantastic. Thank you.